This is Dr. Ayush Bansal. I am MD physician and consultant physician in Gurgaon. Today we'll be talking upon the latest updates in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular diseases, which affects around 45% people in the age group of 40 to 69 years. Raised blood pressure is among the most important risk factor for cardiovascular diseases. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of adequate primary care, and poor follow-up. In India, the prevalence has also gone up over the past 30 years to 38% in men and 32% in women, from 29 and 28% respectively. Despite that, nearly half of the people with hypertension were unaware of the condition. Additionally, over 62% of men and 53% of women living with hypertension do not take treatment. The International Society of Hypertension has released the ISS 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment guidelines attempts to address this issue. Optimal care refers to evidence-based standard of care, and essential treatment refers to the minimum standard of care in low-resource settings. The AHA and ACC has released a scientific statement in 2021 offering new guidelines for management of hypertension among patients with low ASCVD risk. Among low-risk adults with stage 1 hypertension, that is blood pressure, systolic blood pressure of 130 to 139 and diastolic between 80 to 89, the management starts with non-pharmacological therapy. If the blood pressure still remains uncontrolled at 3 to 6 months after non-pharmacological therapy, then we start pharmacological therapy. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, uh, European guidelines in 2018 have recommended that the diagnosis of hypertension should not only be dependent on office blood pressure management, but also on out of office measurements or home based blood pressure monitoring. 24 hours and nighttime blood pressure is considered as the most important relevant measurements for estimating CV risk. For every 20 by 10 millimeters of mercury increment of blood pressure measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines recommend 5 classes of antihypertensive drugs. Considering high non adherence to treatment, the importance of combination pills is particularly highlighted to improve compliance and blood pressure control. Therefore, these guidelines recommend to start the therapy with a dual fixed dose combination of a ACE or ARB plus a CCB or a diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely nitrosodimethylamine, that is NDMA, which can be found in candesartan, irbesartan, and valsartan. NDMA has been classified by WHO to be carcinogenic in humans. If 1 lakh patients receive NDMA containing valsartan every day for 6 years, it could result in 22 additional liver cancers over lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they take the drug daily for 4 years. According to Hygia study, which was the largest study that tested nighttime antihypertensive treatment, chronotherapy was associated with a significant reduction in endpoints, including death. This trial tested whether nighttime therapy, in comparison to usual morning hypertension therapy, exerts a favorable CV risk reduction. This study included a total of 19,000 hypertensive patients. During an average follow-up of 6 years, around 1,700 participants experienced the primary CV outcome, and ambulatory blood pressure measurement was performed for 48 hours to collect data on how BP differed during sleep. The relative risk reduction for CV events was significantly improved for nighttime treatment, whereas compared to the awakening treatment. Thank you.